Mahigit 4,000 ang panibagong COVID-19 cases na itala ng Health Department ngayong araw. Hindi kasama dyan ang data mula sa sampung laboratoryo dahil dito pumalo na sa 1,280,773 ang kabuuang bilang ng tinamaan ng sakit. Lagpas na rin sa 22,000 ang nasawi matapos itong madagdagan ng 75. Higit sa 7,000 pa ang gumaling habang ang active cases lagpas na sa 56,000. Kausapin natin ngayon si OCTA Research Fellow Father Nicanor Austriaco. Magandang gabi po sa inyo, Father Nick.
Good evening, Pia.
Yes. Well, Father Nick, can you tell us what kind of a situation are we in right now? No, we're not yet, para bang, kumbaga, we are not yet out of the woods, but are we in a worse situation now in the month of June than we were in March and April?
Well, what we are seeing right now is the effect of the surge we experienced in the NCR in March and April, now spreading through the rest of the country. So the NCR situation is actually quite good. The numbers in the NCR Plus are at a low, and we are actually attaining levels of daily cases that resembled the period right before the surge. So in the NCR Plus, we are recovering from the surge. However, what has happened is that the new variants that took over Manila are now overtaking the rest of the country. We have heard anecdotally that the surges in the rest of the country can be attributed to usually two things. Usually there is a locally stranded individual from the NCR Plus who has returned home to the provinces and brought the virus with him or with her. And then there are reports of super spreader events that triggered the surges in the different regions of our country.
Mm-hmm. But Father Nick, right now, so of course the variants, but we also have the vaccination that's, well, slowly taking off, no? When can we see better numbers because of the vaccination? Because everybody says, we've been told, this is going to be a key factor to end this pandemic.
So as you probably know, the national government has prioritized an NCR plus 8 vaccination strategy that will focus on the NCR and surrounding provinces, and then with that, Davao and Cebu. The experience from Israel suggests that we will see an impact on the pandemic once 40-50% of the population is vaccinated, and based on some very rudimentary calculations, we therefore expect to reach containment or population control protection in the NCR plus 8 around October, with the hope that we would reach herd immunity before Christmas.
Okay. Father, when you say we hope we will reach herd immunity before Christmas, when people hear that, they will say, naku, pwede na mag-Christmas party, pwede na mag-Christmas reunion, family reunion. Pwede na ba, Father? Or should we be extra cautious first and do what we did in Christmas 2020, itong Christmas 2021?
Well, I think a lot of people are hoping for an old, normal Christmas. And I think that should be the target of our citizens, especially those who are living in the NCR plus 8 regions of our country, that if we step up, if we go and receive our vaccinations between now and then, our plan and our hope and our prayer is that we will have a normal Christmas with simbang gabi, with singing and family reunions and hugging and close indoor dining. This is a possibility. It is something we need to aspire to. This is what we have to all together try to attain for Christmas. It's possible. It depends if all the Filipinos, all our kababayans decide that it is something we want bad enough that we will all go get vaccinated.
Wow, if that doesn't convince all these people who are hesitant to get their vaccination, I don't know what will. So that sounds like a very convincing argument, Father. Pinoys love Christmas anyway. Father, ito na lang, last minute na lang. No? I just wanted to ask first about your your COVID vaccine, no? Your oral vaccines for COVID that you are developing. Ano na ba yung balita? Are we going to see anything very promising very soon?
So my research team and I completed the vaccine in the United States last week. And now we are beginning the animal studies that are required to test the vaccine to see if the vaccine candidate actually elicits an immune response. This will take several months here at UST. And we are assembling a wonderful expert team of scientists at UST to do the tests. And our hope is that by the third or fourth quarter of this year, we will have good animal data that will allow us to apply for a permission from the national government to conduct clinical trials here in our beloved country.
All right. Thank you very much. Maraming salamat po sa inyo, Father Nicanor Austriaco, OCTA Research Fellow. Salamat po, Father.